In these remote Ethiopian villages, scattered across a sweeping landscape with few roads, it's difficult for health workers to make an impact. Many of the villages are extremely poor, and living conditions are as basic as they get. As a result, Ethiopia has one of the highest child mortality rates in the world. Dr. Tom Lietman of the University of California, San Francisco, has been studying the area for some time.
The most common causes of death in preschool children are the infectious diseases. They're malaria, they're respiratory disease, they're diarrhea. As a matter of fact, those three account for more than half the deaths in children.
But two studies co-written by Lietman are raising hope. There's strong evidence that the antibiotic azithromycin has benefits far beyond its primary objective. Azithromycin is taken orally to fight trachoma, an eye condition that is the leading cause of preventable blindness, affecting more than 40 million people worldwide. The drug is given as part of a trachoma control program administered by the Ethiopian government along with the US-based Carter Center and other partners.
This is a very strong antibiotic. It's just given once a year. Number of tablets could vary between 2 to 4.
Here in rural Ethiopia, trachoma is a common disease that can be detected by redness and painful scratching beneath the eyelid.
Children get infected with ocular chlamydia, which causes trachoma, at a very young age in this environment, probably months old. And they contract it from their elder brothers and sisters in the house.
In the first study by the University of California team, selected people in some villages were treated with azithromycin, while other villages did not receive it at all until a year later. Trachoma takes years to develop, so the delay was not considered a problem. However, when they studied child mortality, there was an unexpected finding. In the villages that received azithromycin, the rates had been cut in half for children between the ages of 1 and 5.
The rates you'd expect in this area of Ethiopia may be 8 or 10 deaths per 1,000 children per year. And we found 8.5 deaths per 1,000 children per year in the clinical trial. So exactly what we expected. Now, the children who were in communities that were randomized to azithromycin distribution had about 4 deaths per 1,000 people per year. So it was about half as much.
A second study, using a different technique, gave the same results. In this study, the entire population of 24 villages were offered azithromycin. About 80% agreed to take it. 2 years later, researchers compared mortality of those who took the medication with those who did not. It's not clear why azithromycin had such a significant effect on child mortality in the studies, but the research showed that children were less likely to die of an infectious disease.
I would be much happier if we didn't see these flies coming to the faces.
Paul Emerson, who leads the Carter Center's trachoma program, says azithromycin is popular for other reasons as well.
They enjoy giving people the azithromycin because, in addition to the effect on trachoma, it is a very useful drug and clears skin infections, respiratory tract infections, has a very positive effect on diarrheal disease, and even helps to prevent malaria.
But even with these encouraging findings, some people in the global health community are opposed to mass distribution of antibiotics as a kind of catch-all. They fear that overuse could lead to resistance to the antibiotics. An alternative, or a strategy that could be used in conjunction with antibiotics, is a program to improve sanitation and in turn reduce fly and mosquito breeding grounds.
That's this one.
Efforts like this are well underway, promoting face-washing regimens and the construction of latrines.
This is the type of latrine that we're promoting.
But clean water and sanitation campaigns can be costly and difficult to implement. So research into widespread use of antibiotics will continue. A 3-year study is being planned for the West African nation of Niger, involving 600,000 people. That's 10 times the size of the Ethiopia studies. Researchers hope that effort will shed more light on the benefits and any possible negative effects of the use of antibiotics to save many young lives. For CNN, I'm Gary Stryker.